Welcome to Global Development Interrupted. My name is Leah Petit, and if you've ever wondered what global assistance did for the world and for the United States, then you are in the right place. In this episode, we're going to be talking with Ben Eveslage. He works for an implementing partner, an organization that is funded to deliver U.S. assistance on the ground. And he was in that role when the 2025 stop work order froze nearly all global assistance overnight. Ben watched the impact unfold in real time. And what he did was he picked up his camera and got on a plane. And that moment became Holding the Line, his photography project documenting frontline healthcare workers who refused to stop, even when everything around them was crumbling. So let's go meet Ben and learn about his story. So we're going to start. I want your full name. And then where are you currently sitting?
I'm Ben Eveslage. I'm in Mexico City.
And Ben, this is a bit different in terms of our interview because you have not worked at USAID, but you have been working as an implementing partner for USAID. Is that correct?
Yeah, it's correct. For the last 10 years, working on HIV programs under USAID and PEPFAR, many different regions of the world.
So I am sure that you have also had to pull out a fun fact at some conference or meeting.
To introduce myself,
Yes. So love it or hate it. I want to know what your fun fact was.
I think the term icebreaker kind of like, I don't really love it. But usually one that is a little more fun is like the two truths and a lie. So I'm going to turn this around. Maybe this is like a little bit of a game.
Okay.
I first came out of the closet when I was 18 while living in Ghana. 2, I've had several photos published in the New York Times. And 3, I'm naturally blonde. So you got to tell me, what do you think is the lie?
Okay. So is it the New York Times?
Yeah, that's the lie.
So, Ben, now that we know that you're a natural blonde,
Yes.
where did you grow up?
I grew up in Michigan, Dearborn, Birmingham, Michigan, suburbs areas. When I was growing up there, suburbs, you know, I don't know, it just felt like small mindsets, kind of conservative. And I obviously just mentioned that I came out. So, at the time I was realizing that I was gay as a very young person in high school and even before high school. And, a lot of those early moments shaped my worldview. Suburban America, middle class appearance, but definitely impacted by the recession at the time, the housing crisis. I guess you could say like housing insecure was a way to describe my family. So a lot of that time was spent thinking like, how do I get out of this? How do I get out of these suburbs? How to get out of this reality? And at the same time, a little bit earlier was 9/11, the war in Iraq. And that was the same time that Bush launched PEPFAR. And at the time, I didn't know what PEPFAR was. I did know about 9/11, of course, and the war in Iraq, but it just opened my mind to like how the country I grew up in was so interconnected in the world. And in middle school, we would be asked these questions, pros and cons of going to war in Iraq. And what a weird question to ask a 15, 14-year-old. Like, what is it about my opinion that matters about going to war in Iraq? Who do I know in Iraq? No one. So my first thing that I did is I went home. I went on this messenger called ICQ Messenger, I think it was called, and you could tab through users by country. So I went to Iraq. I went to Baghdad. As Operation Shock and Awe was underway in Baghdad, I was messaging people, random people. How is it going? What is life like there? What are your concerns? I just start making those connections with other people from different backgrounds. And I think that was also like a natural impetus for me. Do the work, go to the places and hear the people. And that was always a bedrock as well, is that I've taken into this field of work um, for my life.
And do you think was this encouraged mostly through school, your family, or just you being naturally interested in what others are feeling across the world?
I don't. That's a very good question. I don't think parents or school. I think it's probably because I understood my sexuality in the context of both looking inward and also using the internet as a way to like discreetly learn about this existence and what it means and other people's stories, and to realize that there is life after this difficult period of adolescence and teenage years, and it's going to be okay. So just hearing those stories from across the internet was like my hope.
It's almost as if the internet sort of opened up this new world to you. You were posed
It
with
did.
these questions and you went and out and you searched them out online. Well, and then what I think is interesting about this conversation as well is that your work with implementing partners has been very focused in the digital space as well.
Yeah, I think it's all connected. I think, I don't know, being gay or yeah, all that like is a connection to like why I looked for hope online and connection and, you know, other people like me. I that was like the thesis that I had in my master's is like I went out back to the field in Ghana and asked 100 or so people from sexual minority, gender minority groups, their experience, how they grew up, what was the role of the internet in their identity, and who they met. And I realized that so many of the HIV programs that are implemented do so in a space that is being constantly restricted, which is these physical spaces, which are these bars or hotspots where people would meet. And especially for the LGBT community, those physical spaces, as the internet became more popular, the physical spaces became much more targeted. You could put them on a map, you could label them, you could identify them, and you could sort of like harass them and close those spaces down or limit those opportunities for people to meet. And so the internet was definitely a double-edged sword for many communities, but it in some ways it remains a lifeline in terms of connection and support and hope and stories. And so that was why we led this big change in HIV programs to begin reaching people online, ensuring that where they're looking for information and services online, that they're getting the correct information and they're connected to people who can provide services and be linked in to a support system. So yeah, it is all connected at the end, I realized.
So what were you doing?
Yeah, so I had started well, I think I can mention I started at implementing partner and I got in and it was very quick onto the beginning of USA's linkages program, which was very specifically focused on key populations. So it was very niche and the first sort of publicly framed global project focusing on key populations and HIV. And it was meant to really bridge that gap between HIV service delivery and human-centered focus, stigma discrimination that these communities face. And one of the first comments I made in a team meeting was like, they're always talking about hotspot mapping, like these physical places. I'm like, I think in a lot of the countries we were working, these hotspots like have like shifted or they're not really there, or like many, especially if it's MSM we're speaking about, men who have sex with men, they shifted online. I think what we're doing is quite outdated. And I was like disregarded. They're like, then we need to set up our programs. We need to start with the basics. And they weren't wrong. But my perspective is when it's HIV, can affect everyone. You need approaches that reach each of these communities in the places that they are. Um, so this approach really, really scaled after I had back channeled this message through 3 HIV program leads: Kenya, Indonesia, India. They presented to our global team, and they're the ones that bought into receiving technical assistance on how to do these things. And
And
there
what
have
are
been
these?
HB programs, how to reach key populations online, how to know where they are, what are the size of the populations that you could find online, how to link them from online spaces to offline HIV services in a way that's tracked, that is effective. And that's what we led with. And we developed this app that was launched during COVID, which allows any HIV program to load their clinics, load their outreach workers, and have outreach workers connect people to booking appointments at any of these clinics and track that the referral was effective, and even like anonymously track things like case finding, linkage to ART, linkage to PrEP, and give a great way, even now, for programs to create demand for publicly and at a high level, like through social media, new products like LEN, long-acting PrEP, hopefully long-acting ART, commodities that could be delivered, particularly HIV self-testing, something you can do in the convenience of your home.
I just want to pause because I think we also need to provide context of why this is so great. Because I think in the United States, we get our email messages reminding us of our upcoming appointment, or we might get our text message. But this was a very new space, and well, not new, but like well, yeah, maybe new for
It
many of
was
the
new at the time. Yeah.
yeah. New at the time because the way that someone's medical records were documented in Northern Cameroon is they had a little notebook and it was a card, and the doctor would write on the card what
Mhm.
happened and what was going to happen next. And then they would take that card home. And I can tell you that card got lost a lot, or
Yeah.
it got rained on, or so there was no real effective way to track. So having the digital recording, having that electronic medical record was a huge innovation.
Yeah, I mean, there were yeah, I mean, there were multiple teams doing this around the world. I think we were the first to have this global approach to linking clients to HIV services through like a self-care mechanism. And my own perspective on it is that it really met a need. It still meets a need, but the way it's been implemented is still a little niche. It's not necessarily for everyone. Not everyone can go on a website, you know? There are some limitations, but a lot of impact. Imagine 45 countries have used this approach in Latin America, the Caribbean, Africa, parts of Europe like Ukraine, the Middle East, Asia, and the Pacific. And, getting near 1 million appointments on these applications, it is very gratifying to be like, all the way from the beginning, me coming out or me understanding my sexuality, using the internet to connect to other people, find hope, and building it into an app that people can use. And it's not all me. There's a team behind all this. But to say that our team can say that because of our efforts, like 1 million people got access to testing, treatment, PrEP, post-violence support, mental health. We can track it all.
Also, just the data collected that then clinics can use to improve their services.
Exactly. And it's at their fingertips. Yeah. So it's a lot of pride behind all the work and a lot of grief when it started falling apart in January.
Okay, so that's where I was going. So you built this team and suddenly you're being told we're going to scale back. We don't have the funding. You have to tell people that they're being let go.
Yeah. The end of January was really hard. I mean, it was at a moment when we really didn't know what the future looked like. I had told some members of my team back in November, after the election, that a lot of things would change. And I think I didn't have a lot of hope. Then the stop work orders came through. Those were far reaching. The impact was so significant, but also so far from where I was like physically. I wasn't in the field when this was happening. And all I could see is the appointments on our system just dropping. And we had to take the systems offline. So it was dramatic and lost my whole team. I mean, I have one team member left that I was able to keep, was reduced to part-time status. And I maintained my status as part-time just so I can do other things with my life. And so the lead into this project this summer was I've been doing a photography book based on my travel and street photography. And I realized as I was writing captions, the captions became chapters. The chapters became like stories about my life and also what this life has meant to me. That there was a huge omission, which was my work, which was the majority of my life. I spent my whole youth on it and sacrificed a lot of my youth on it. And that was missing. And there's one photo that I took the year before in 2024 at the AIDS conference of a man in a photo exhibit at the AIDS 2024 conference in Munich. And there's these towering posters around him. It's a photo exhibit of people in the HIV response. And I realized that that was like me. I was like standing among other people's stories, the people who I came out to in Ghana, the people who I had messaged in Iraq when the U.S. was going to war with them, learning about their experiences. Like my story is the sum of all of these stories of other people. I'm just this I'm just this boy from Michigan, a suburb. I had lost the closeness to those stories over the last 10 years. Um, while working at a larger scale and having a bigger impact globally, I lost that human touch, the human connection. So um, I thought a couple things. One, I needed to write this chapter on my work. I wrote the chapter during the stop work order, and I ended saying, where do I stand in my own story? Do I stay? Do I go? Do I like stay in this career? Is it worth it? Or do I try to do something different. And I thought, I just got to double down and see how it feels. And that's why I did the photography project, a way to just reconnect with the people that are at the heart of this work on the front line of the response to HIV and hear their stories, not knowing what they would be um, and not knowing how they would impact me. And just taking the time to, sit back and experience this depth of this deep human experience of the stop work order and who's continuing to work and what their perspectives are. 'Cause I don't think anyone can tell what the future holds. Um,
I can.
and yeah, okay. Please tell me.
I think what you just said, though, about stories interweaving to create a person, I mean, isn't that humanity? How all of our stories interweave together to create this beautiful life that we live. So you decided to get on a plane and write this next chapter of your life and of the work.
Yeah, yeah. Flew out to Ghana, Rwanda, Uganda, Kenya, Mauritius, Mozambique, and South Africa, and just throwing myself out there. Every person that was willing to meet, share their story, go meet them where they are, hear their story. Every day, asking some of the same questions, why do you do this work? What was the impact of the stop work order? What do you see yourself doing next? What motivates you to continue working?
And who were you interviewing? Were you interviewing people from local organizations receiving funding from USAID? Were you interviewing healthcare workers?
The focus was people who are on the front line of the response to HIV. I left in mid-June, arriving at a time when a lot of the impact of the stop work had already happened, and I wanted to meet with people in settings where they're still doing work. So this would be frontline staff, nurses, clinicians, lab techs, pharmacy staff, outreach workers, case managers, a lot of those, and local organizations, some previously funded by USAID, directly impacted by funding cuts, others under the Global Fund, others under other funders. I wanted to also make sure I got perspectives on what they're planning on doing differently, even if they weren't directly impacted. What were the indirect impacts?
And what were sort of the main themes that you were hearing from these different individuals about the stop work order and the change in funding?
One, a lot of worry and fear after the stop work order, widespread, was like the bell you can't unring. When a rumor spreads and there's a lot of fear and a lot of dependence on the US, and a lot of public awareness about the dependence, it causes a lot of fear, especially among people living with HIV. Many people had assumed that there wouldn't be ART. People, they were lost to care. They thought they couldn't come into the clinic. People did die that are like direct reports from organizations. And the ones that I received were Uganda Harm Reduction Network running a MAT clinic, and the individuals on opioid substitution therapy. The clinic was closed immediately, and there were 200 overdoses and 2 deaths in the week after the stop work order. Two, US government statements around like not implementing gender specific programming led some implementers and clinics in country to reframe that in their own words to say, we can't serve you if you're transgender, go back home. There are definitely reports of clinics saying that because they're supported by the US government, if someone's coming in for care, ART, they were turned away. Those were quickly within, I think, at least a month, clarified. But once you send someone away once, don't have the assurance that they're going to be able to come back or even get the message that, sorry, we didn't mean that. Please come back. So that's some of the impact. I would also say deep appreciation. I was surprised by this, given the timing of when I traveled, deep appreciation of the US government for the support they provided since the beginning of PEPFAR on HIV programs. The number of people I spoke to who were the first recipients in their country to receive ART after having been infected with HIV for several years and on literal deathbeds. And one woman who survived the genocide in Rwanda and then intentionally infected with HIV during the violence and the genocide, and with the advocacy of local organizations and support of the US government getting on ART and surviving until today. So I can go and I can ask her about her experience.
And
Of course, and
ART
like
is just the HIV treatment drug.
Yes, it's the drug that keeps the replication of the virus at bay, and essentially prevents enough of the virus to be circulating in your body to be transmitting to other people. So the important part about treatment is that it prevents people who are living with HIV from passing it on to their loved ones. And that's why we now know that if you're on treatment, you can be virally suppressed and you can have kids without HIV. And the number of people that I met living with HIV who are so grateful to the US government for the support they provided and the drugs and the stigma discrimination work that have made it possible for them to now have kids and have this like HIV free generation is such a shining hope. So I would say that appreciation is number two.
Can we go back to the woman who survived the genocide? And did her family perish because of HIV? Was she the surviving member?
Her family were targeted, and her husband was killed in the violence, and she was intentionally infected with HIV by members of the militia. And it was a couple years later after the genocide that ART became available, and there was a specific name for a ward in the hospital, which is like the last stop before death's door. She was in that ward, and to have a story of someone that was there and made it out and survived, it's like she's living the afterlife. And it was because of ART. She just says she doesn't want anyone to experience what she went through. And she dedicates her time to mentoring others. She receives calls from the network of people living with HIV of someone who needs a helping hand. She goes to their house, speaks to them about her experience and helps them with, taking the drugs and what it means. So I think that is actually, I'll just mention that as the final like lesson, high level, is the number of people that have been through a hard place and have used that to help others. And it's usually from the common quote, like, I don't want anyone to experience what I went through.
This story to me shows or spotlights two things. One, the miracle of ART. She was at death's door and suddenly there was treatment and she came back to life. That's a story that you hear over and over and over again. And one of the reasons why even just the misinformation about ARTs not being available in country is so scary because it means
Hmm.
the death of a family member or yourself. And
Hmm.
then the other part of that is her dedication to supporting others through sounds like community health work as well,
Yeah.
because there's still a lot of stigma and something that has been removed from our funding is that community health work.
And I think the one piece that for me is still like hard to describe is the impact of stigma. If ART is like a miracle, I think you can dampen your expectations when we understand the impact of stigma. A drug itself can only go so far when people are too fearful to access it. Or they have such a low image of themselves, self-esteem is too low to think that they're worthy of a life. And I do feel like this is probably the one area where if there could be additional research to understand why we're going to be seeing these big impacts in terms of number of new AIDS-related deaths, it's going to be a large portion is going to be from this. It's just the fear compounding with stigma, no few ways to combat it or less funding to combat it, and how that impacts people's willingness to uptake the miracle, which is ART.
Right. Because you need resilience. You need mental resilience, emotional resilience. And you usually get that through the community, your friends and your family.
Yeah, yeah. There's some parts of me that feel very distraught about the world and the lives a lot of people live, and I think in many ways I felt this way about myself. But like so many things that should be okay, you know, that the people you care about that are your support system, not every person has a family or support system that'll say it's okay. And that's where things start to fall apart in relation to HIV. It's a lot easier to say, here's pills, it prevents HIV. Here's pills, it controls the replication of the virus. And these are your answers. But the reality is, humans are complex, and a pill is not going to fix everything alone.
Ben, after going out and traveling and talking to people on the front lines, how has that shaped your perspective now on global development and what we are currently going through in this industry?
I think it's a really hard question because I would hope that I have incredible insights and that I have a new light at the end of the tunnel, like to guide me through and give me the motivation. I don't necessarily have all that. I think I started out with doubts and kind of a sense of hopelessness for our field and my work. I emerged after this project and after engaging with so many individuals with hope. I don't know what it's really grounded on, but I think it's grounded on the fact that there are so many people who are continuing to work and fight in the field for their communities. And it's not all over. I have suspicion that things will look quite different, no matter who wins the next election in the U.S. I'm sure things in international development and HIV will look quite different in terms of how we do our work. So I still think that I still have a little hope for our work. I have a little less hope in the U.S.'s role in all of it, a little less. Um, I don't know how to say it, maybe a little less um, ego about my own role as an American or working for an implementing partner based in the US in this work. Maybe much more appreciation for the local partners and the work that they do.
I was thinking about the things that you have seen. You have seen incredible resilience within these different communities that still have hope. You saw appreciation for what the United States has given and fear from what they're taking away. So, for an American audience, what should they take away from that?
Yeah, I almost like want to give you the floor because you framed it really well. I mean, I would say like to Americans that have been slightly aware of the work that the US has done globally, don't abandon it. The amount of people, lives that have been saved around the world due to PEPFAR is huge. 20 million lives saved due to PEPFAR. It is one of the most successful and reputable types of USAID programs or foreign assistance work of the US government.
All right. So, Ben, where can people find Holding the Line?
They can go on their website, it's holdingtheline.blog, and they can find the website there. They can register with their email to receive the new stories. There's no spam. It's simply when I have the time to write a full article, get all the photos in there, it'll go out to email to people that subscribed, and it'll be permanently shown on the website. So I've got several different kinds of stories, those that focus on individual people, like a nurse or a provider giving their story. Others are based on an organization and the network of people behind a response and the challenges they experience. And I'll be giving links to each of the organizations that are featured in the story in case people want to directly donate or contact them, to ask how they might want some support if someone wants to donate their time or their skills. A lot of these organizations are really, really excited to work with other people that have the times and the skills to contribute.
That sounds like an excellent way for individuals to give to many of the organizations hurt through these funding cuts.
And I've seen people do this so much. People like that have worked in our field, USA, just going to the field and and spending time in a clinic they used to work with under USAID, um, and like pro bono. I mean, that only lasts so long, but I think it's just great that so many people like yourself and others that I've seen in the field dedicating the time to like reconnect with the roots and see where that takes them.
Yeah. As Lauren Murphy in my first podcast episode said, hope is the hard choice. But I think what we're talking about here is that we see the hope every day and the people that are willing to put themselves out there to help others. All right. Well, Ben, thanks for joining me. This has been a very fascinating conversation, if not thought provoking at every turn. So thank you. This is Leah. Thanks for joining me. If you enjoyed this episode, follow Global Development Interrupted wherever you get your podcasts and subscribe on Substack to get new stories and updates straight to your inbox.